Okay, so now we are going to do neostigmine, mechanism of action, then uses and adverse effects. Start.
Neostigmine. Neostigmine is a reversible anticholinesterase. So this is the cholinergic neuron. This is the postsynaptic tissue, and here we have receptor. So here we have acetylcholine. So it gets released to synaptic cleft, acts on the cholinergic receptor, and afterwards it gets degraded by acetylcholinesterase enzyme to choline and acetate. This choline is taken back. Now, how does neostigmine acts? Neostigmine, I'll write just N here. Neostigmine is going to inhibit this enzyme, acetylcholinesterase. When this enzyme is inhibited, acetylcholine is not degraded and it increases and acts on the cholinergic receptor. Its main action of neostigmine is acting on the acetylcholinesterase and increase the concentration of acetylcholine and you get the cholinergic action. Cholinergic action. Now, where is this uses of neostigmine? Just a pause.
Hi, sir.
Pause. Where is your notes?
No, if we can't pause it, that's the thing.
Where is your notes? Because I want you to read the uses. I'll explain them so that you can also read and I can explain them. We wrote, na?
Sir, we can't pause it, sir.
Then you record from beginning. I'll just show it.
No, sir, it's fine.
You told about 5 to 6 minutes first, no? Then
No, that was the second thing what we wrote.
Okay. Pile of purpose we would have told you. It's okay. Now we are telling here. Okay? Use of neostigmine. You just tell me the use, I'll explain it.
So now the uses of the neostigmine is the myasthenia gravis.
So first one already I told it is used in myasthenia gravis. Myasthenia gravis. So in myasthenia gravis there is a weakening of the skeletal muscles. So why? Because there is a development of autoantibodies against NM receptors. So suppose if these receptors are blocked by autoantibodies, you have only few receptors for acetylcholine and that's why the muscle power gets reduced because the available number of receptors is very less. So when you give neostigmine, it is going to inhibit this acetylcholinesterase, increase the concentration of acetylcholine and that will act on the available number of NM receptors and improve the muscle power or strength. Thus way, neostigmine is drug of choice in myasthenia gravis. One of the advantages of neostigmine is it will not cross blood-brain barrier. Neostigmine does not cross blood-brain barrier and that's why there is no central nervous system symptoms, no CNS symptoms because myasthenia gravis is a peripheral disorder and our drug has to act peripherally but not centrally. This is one advantage of this neostigmine. Okay, it reverses the skeletal muscle weakness and improves the muscle power. What's the next use?
Atonic bladder.
Atonic bladder. So, what is atonic bladder means? Here in this case, what happens? The bladder muscle has lost the tone. Muscle tone is lost. Okay. Loss of muscle tone. So, because of this, what happens? The bladder is not contracting. And there is a urinary retention. And here we have M3 receptors. So when this neostigmine inhibit this acetylcholinesterase, the acetylcholine concentration increases and that can act on the M3 receptors on the bladder smooth muscle and cause bladder muscle. Here what muscle we have called detrusor muscle. The detrusor muscle contracts and urinary sphincters relax. Detritus are contracts, lumen sphincters relax, and there is a voiding of urine. Voiding of urine. Now this loss of muscle tone in the bladder tissue can be because of like a road traffic accident or neurological problem, whatever it may be. So there is a loss of muscle tone. So we can use neostigmine to improve the condition. What is the next use?
Delivery.
What's the next one?
Cobra white poison.
Now some of the species of cobra, they have a poison toxin.
Sir, we have cobra in our house.
Okay, poison. Okay, this poison has neuromuscular blocking effect. That means it comes and blocks the NM receptor here. When the NM receptor is blocked, there is a skeletal muscle relaxation and patient will be paralyzed like. So when I give neostigmine, it goes and inhibit the osteochondrolysis enzyme. Then what happens? The level of osteochondrin will increase. The blockade will remove and this will act on this. That means the toxin will remove in place of osteochondrin act. To reverse the action of this neuromuscular blockade, we can use neostigmine. So it can be used in some cobra bite poisoning. Okay, third use. First, to increase bladder muscle tone, or in case of atonic bladder, and in cobra bite poisoning. What is the next use?
In post-operative
paralytic ileus. So we write here this part. This is GIT, intestine, and large intestine. Okay. Now, suppose if you do any abdominal operations, and afterwards operation got success, and patient is shifted to post-operative ward. Immediately, the doctor writes in the case sheet NPO, nil per oral. The patient is only on IV fluids now because the peristalsis has got temporarily arrested or stopped because you have got external manipulation. Now, after 2-3 days, naturally the peristalsis will start and the patient can take the food orally, semi-solid, solid, etc. But even after 2-3 days, if the peristalsis doesn't start, the consultant physician will come and ask to the patient, did you